Here at Sacred Heart Children's Hospital, we've seen a tremendous level of care administered to children and their families, and it's offered to the tiniest of patients with the most serious medical conditions. That's when the neonatal intensive care unit takes over. You have a lot to show us today.
I do. I'm excited to show it to you. I'm going to start you off today on our graduate wall. There's 150 leaves on this wall that 5 years ago when the unit opened, we just didn't think we'd ever fill it up. But these are graduates that have spent time with us in the NICU. They often get a photograph when they go home, and their moms and dads love to come out and pick a leaf and put them on.
Really, this is a wall of success stories.
Yes, that's well put. 30% of my admissions are transport, so they come from all over the region, oftentimes at night. And they fly in, mom or dad has come with baby, they have nowhere to stay, and we have a room that's got a sofa bed, a full bath shower, phone. We just put them to bed and say, just stay here and we'll work on housing tomorrow. In the old unit, there was nowhere for our families or visitors to go when they weren't in the unit with baby. So they built this huge family waiting area that's got, again, telephone, coffee, a place to put a frozen dinner, microwave. It's theirs to use, bathroom, and we really had a lot of people in here with, high census, but it was a huge add-on.
So Jean, we're at the entrance now.
We are. Every family member that comes in, this is a locked unit, so they have a chance to buzz in, say, I'm here to visit baby. They sign in and go see their baby. This is called the center pod. We had to give them kind of fun names, so we call it Grand Central because we had to call it something. But this is a typical two-bed room. You're welcome to come in. And right now it's set up for twins because we're expecting a set sometime. And the room is split in half. So you've got this is a set-up bed for one baby. The bat one is identically set up, and nurses can go back and forth. A premature baby, all their care is based on their gram weight per day. Every time we have a wet diaper, we have to weigh it. Because you weigh it first to remember what your gram is, and you weigh the other one, and there you go. It's just its own world of, they can't make a move if we don't know about it.
This is Kai.
Oh. And why is he an ICU baby?
He had respiratory distress, so he was put on a ventilator, and then he went to CPAP, which is continuous positive airway pressure.
And he'll be able to go home when, do you think?
Shouldn't be too long. There's some things that babies need to do before they get to leave. They have to be able to hold their own temperature, which means that the bed's not going to help them in any way. He's doing that perfectly. He needs to be able to take all his food by his mouth, and he also has to be growing. So he's well on the way. He's got several steps accomplished. He's just got a couple more steps to accomplish to get to go home.
Just precious.
The NICU was just one piece of the journey of a family or a baby pregnancy at risk. We have a NICU follow-up clinic that we see kids up to 2 years of age to make sure they're right on track for development. We get them also connected to services before they leave here and also to the follow-up clinic. But we're just part of that big process of, I think, some really great care.
Well, obviously you're very proud of this facility.
I am.
Another major area of care here at Children's Hospital is the cardiac unit. Their ability to deliver expert, personalized care to infants, children, and adolescents is simply unsurpassed.
When I moved here, my specialty was in fetal echocardiography, so we decided to really develop the fetal echocardiography program here.
Pediatric cardiologist Pam Berg is part of an amazing group of physicians dedicated to helping children with heart defects at the earliest stages of life.
At 18 weeks is about the earliest we can get a very good look at the fetal heart. You have to remember that whatever heart malformation is occurring in the baby, it's already set by the 8th week. So here we can see baby's face. Here's the eye, the nose, lips, chin, baby's chest. Right here you can kind of see the heart beating here. We can see the vein bringing in blue blood into what, when the baby's born, would be blue blood coming into the heart chamber. This is the aorta, which sends blood flow out from the heart to the body.
Children's Hospital fosters an atmosphere of teamwork where specialists and surgeons combine efforts to create the best patient care.
It's a bicuspid valve. I'm pretty sure it's probably going to need replacement at some date.
We work very closely with our pediatric surgical team. We have 3 excellent congenital heart surgeons here, Doctors Leonard, Seawick, and Worrell. We meet with them very regularly to discuss our cases that we believe will need surgery in the future. They're fantastic.
We thought Ben was entirely healthy. He was born no problems and grew up, was a normal little kid.
What you gonna do today?
Well, they're gonna fix up my heart.
Yeah?
Yep.
7-year-old Ben Mack is your typical boy in most aspects, and he's also more than willing to tell you he needs work on his heart valve.
They're gonna replace it or they're gonna fix it. Hi, Grandma.
Ben, totally normal young boy, but his mom had noticed that he didn't quite keep up with his peers. When he was out running with his friends outside, he's always the last one. And he even would complain that his chest would hurt when he'd really push him, because he'd really wanted to keep up, just like any boy.
We sort of believed it was nothing and went to see the cardiologist, and they did an EKG and then the echocardiogram. And after that, Dr. Berg came out, and her words to us were, "Your son has a very serious heart condition."
We were able to identify that the aortic valve, the main valve that pumps from the left side of the heart to the body, was not formed correctly and was leaking quite a bit. So here is an echocardiogram, and this is a view, what we call a long axis view, where we're looking up here at the chest. This is that left ventricle that's pumping out the aorta, and all this blood that's blue is going the wrong direction. So this is supposed to go out and be red coming towards my transducer, but whenever that valve shuts, it leaks, and all this blue blood is regurgitating back into that left chamber.
Ben's condition is serious, but the family-centered approach to his care at Children's Hospital puts his parents' minds at ease.
Dr. Berg did a great job of just explaining all the, I mean, this is just before we even knew exactly what would happen today, you know, in surgery. Here's all the possible options. Here's what we're looking forward to in the future.
All right, so our plan is we're going to look hard at this valve, see if we can figure out a way to get it from leaking a lot to not leaking more than a little. You know, if we have a little bit of leak, but have it substantially better, then we'll be happy with that. And if not, we'll be replacing the valve, right? All right, we'll get going, Charlie.
Can I pray for you?
From the surgeon to the anesthesiologist, to the child life specialist, to the nurses, it all comes down to teamwork, and it begins before Ben is ever wheeled into surgery.
I love you, bud. I wish you would my PS.
Say bye.
Bye.
Do you want to take pictures?
All right,
You're going to do awesome.
We're going to take really good care of him. See you later. We'll call you soon. All right, here we go, buddy. Good job. You did great.
The day of surgery, we're as prepared as we can be. In the operating room, we do one last check. We use an echocardiogram from the esophagus, and that gives us beautiful pictures of the heart. Sometimes we're able to find details there that we didn't see before. And actually in Ben, what we realized was that that valve was missing a piece. Dr. Seawick, knowing that information, was able to prepare, before he even started surgery, by taking a piece of pericardium, which is part of the sac that the heart sits in, and use that to patch the aortic valve.
For the Macs, hearing the best possible news on Ben's surgery is a huge relief.
So I don't know if you got any word, but the surgery went just fine. Really, the valve actually, frankly, looked a lot worse than I thought it was going to.
Okay.
And I was a little concerned about whether we're going to be able to figure out something to do to fix it. It was really just a gap. A bunch of the leaflet was missing. As opposed to having too much leaflet and having it be too floppy, there was just this kind of hole in the leaflet with very thickened, like a horseshoe of scar tissue. So we ended up cutting away some of that and replacing it with a little patch of pericardium, a little bit of the sac that came around his heart. And it actually looked quite good, and on the echo it looks great. I was real happy that we got it looking as good as it did, and he's tolerated the surgery just fine.
Good.
They're just getting ready to bring him upstairs shortly.
Good.
Okay?
Thank you so much.
So you'll see him up.
We're so thrilled. He'd had an excellent result.
For Ben and so many children like him, his surgery was a huge success. Amazingly, just 3 days later, Ben is recovering and will go home the next day.
What would you tell kids now after having your surgery?
Well, it's been fun. If you eat a lot and walk a lot You get to go home faster.
How's his prognosis? Will he need surgery?
You know, he may, because as you can imagine, that patch is not going to grow with him.
Right.
So we're just going to have to keep following him, and we're going to take very, very good care of that valve.
Any limitations?
You know, if his valve functions well, there really aren't any limitations. He can keep up with the other boys.
Well, Ben's case is just one of thousands of extraordinary stories that play out every day at Sacred Heart Children's Hospital. Your family may never need to take advantage of the superior programs and services offered here, but if you do, you can rest assured that your child or loved one will be getting the best quality care this region has to offer. I'm Nadine Woodward. Thanks for joining us.